Hello and welcome to the CanSIMS monthly webinar. Today we're fortunate enough to have Andrew Spain, the Director of Certification for the Society of Simulation Healthcare, and he's here to talk to us about the CHSE examination. So a little bit about Andrew. He's the Director of Certification for the Society of Simulation Healthcare. He's been a paramedic for 27 years, first in the Denver area, then in Missouri. Doing both ground and air ambulance work. This has evolved into directing an EMS program for 5 years prior to coming to the SSH. He has a MA in political science and currently working on his dissertation for his PhD in education at the University of Missouri with an emphasis on educational leadership and policy analysis. So welcome, Andrew. Thank you so much for agreeing to talk to our group today.
Yes, thank you very much. Good to be here, and I don't know if you're all in a warmer stage than we are today. I'm in Missouri, and we're actually coated with ice today. It decided to do that last night for us, so that's good fun always. So nice to be inside and not out and all of that. But you're usually much colder in Canada this time of year. Definitely happy to be here to talk about certification and what you might be able to do to achieve this as you move forward in your professional careers, of course. Recognizing that obviously SSH is one of the, pretty much the only option for exam-based certifications worldwide right now. But nonetheless, just be mindful of sort of where we are with that, because obviously this is something that we have as a business line. And glad to be here to share why it's also valuable. It's not just something that we threw together, because we did look at this as a means of serving the healthcare simulation community. It was actually fascinating when this process started that we found so many people were learning on the job. Our initial surveys actually came back with something of the order of 85 to 86% of individuals were figuring out how to do simulation while they were actually doing it. Again, that on-the-job kind of approach, which unfortunately, it's only decreased now to about 40 to 50% with some of the latest surveys that I've seen, but nonetheless, it's improving. And I think, it's nice to see that obviously the certifications have been so popular since we started them. And of course, a lot of the other work to help move beyond that and give everyone an idea of what good healthcare simulation looks like, what the required knowledge, skills, and abilities are. And of course, certification is one piece of that. Just to make sure that we're on the same page with our language, this is obviously an individual recognition rather than an organizational recognition. In the lexicon, that's accreditation. Of course, there's other words that can be used for organizational type of recognitions. There's also things like certificate programs and other activities that can be done by an individual. For certification, officially that's an exam-based process, the testing-based process that confirms your knowledge, skills, attitudes, and abilities. And that's all, again, part of what we see as the service to the healthcare simulation community, because previously there was no product of this kind that existed. And so we wanted to try and fill that gap and provide those kinds of resources to the community. So one of the key pieces when you're developing a certification is that you have to perform a practice analysis. And I don't know how many of you on the call may have been involved in a practice analysis or some component of it in your various workings over the years, but it's a pretty extensive process. We actually just repeated the practice analysis because, of course, when you're looking at what is actually performed in healthcare simulation or the community that the certification serves, that practice does change over time, and so you do have to repeat that every so often to make sure that you stay in sync with all that and keep current with the actual practice that's going on. And so we just repeated that. We were approved to begin that process back in 2017 and started it then, and are actually just now finally to the point of having launched the exams to support that new practice analysis. But again, very rigorous process, takes many, many steps, involvement of many subject matter experts from around the world to get the input and the verification and support that's needed. We actually, this last time, also went and did an international version of it. We actually went around to Hong Kong and to Amsterdam, as well as our meetings here in the US, to make sure we had subject matter expertise from around the world to see whether the practice had any significant difference culturally or in actual practice, even the legal underpinnings. And it was really neat to see that it actually plays out pretty consistently around the world. And to, of course, do the psychometric analysis. So it's if you've never done psychometrics, there's a lot of heavy-duty statistics, and to, of course, cross-reference all the data that's in there. But it's all necessary to do a really good certification, to have this kind of rigorous process, rather than just something where you're getting around to just saying, hey, this is what we think we do, and putting something together that way. So that's how we went through developing our certifications. And what you see is this is our family of products as it stands right now. I know the focus today is on the Certified Healthcare Simulation Educator, and you can see that this is obviously the individuals who have a lot more information, a lot more experience and abilities with the actual educational design components of it. It's still not to the level of, you have to name 18 educational theories or something like that. It's nothing like that, and we'll go a little bit more into detail with that in just a little bit. But obviously, it does require that there's a lot more of that experience in the educational design components as relates to simulation. The process for both the CHSE and the CHSOS is essentially the same. And the first thing you have to start off with is to answer the question, why are you interested in getting certified? Because there's not much point in starting the process if you don't have that answered. Amongst other things, you need to have some kind of impetus when you get home from work in the evening to be able to pull out some of the articles and actually do some of the studying so you can support your success on the examination. So I would say, just like anything else, you have to identify that value proposition. Are you doing it because your boss said you had to? Are you doing it because it's something that you desire to achieve? Plenty of extrinsic and intrinsic motivations that are out there. Just make sure you identify those, so before you start in the process, you actually know why you're doing it, and be able to meet those reasons. And hopefully there's more than one to be able to get it. And of course, there's even things such as perhaps some of your work are requiring it or preferring it, and you can get some extra money out of it. That's always great. We're starting to see some of those trends, at least here in the US, where it's a preferred certification, sometimes a required one. And so those, it just, again, it speaks back to how the community is valuing the certifications and what it actually means to become certified. And so that's really neat to be able to see again as time has evolved. The first step, obviously, is to look at your eligibility, and focusing on the CHSE side. Obviously, you need to be looking at working in an educational role, and there's lots of ways that you can be functioning in an educational role. Typically, you're actually designing some of the activities, and so you're looking at working through the needs analysis, through the goal development, objective development, designing the scenarios, developing debriefing tools, evaluation tools, perhaps training the SPs, training your other evaluators, working with the operations specialists to coordinate how the event's going to go on. There's many roles that fall into this, and so the key, of course, is just that you're actually participating from that educational perspective. We do obviously have to require that this is for healthcare learners, not some other category like engineers or whatever it may be, because it's the intent of the certification. The 2 years experience is one of those things that we're not looking for full-time. A lot of people on this call perhaps don't do simulation full-time, but we do want the continuous piece of it, because that's how you develop skills and expertise over time through that experiential piece of it, just being involved in it on an ongoing basis, and not just performing a lot of simulation, but maybe only perhaps once or twice a year, say at the end of semesters, for example. And then that last piece you see is the bachelor's degree or equivalent. That's important to understand that we do want the bachelor's degree, but we also recognize that there are many ways to get to what is intended with that requirement. And of course, when you're looking around the world, many people perhaps have not even achieved a degree. Perhaps they've only achieved a lower level degree, what we call associate's degrees here in the United States. And of course, there's different terms as well, which is one of the reasons we have to have the equivalency process to capture the wide variations that we have in degree options around the world. And as well, of course, the experiential component. Again, not everybody gets to the same level of expertise through going to school. They can get that through, again, the experiential components of it. We just ask that if you do not have a clearly identified bachelor's degree, that you submit for that equivalency process ahead of time. It's a free review. That we don't want to have to, refund your money if for some reason it's not approved or anything like that. So we just make sure that that process gets done ahead of time, and we can engage in the conversation with those who don't have the bachelor's degree to make sure we're capturing all of their education they have completed, as well as, of course, their actual work experience in healthcare simulation to be able to award them that equivalency. Once you have decided that you meet the eligibility criteria, then you would go to our website to complete the application. Now, there's a fairly simple process to go through. If you don't have a profile, you would just go through and put in the basic information that's required, things like name, address, etc. Obviously, your email. It's important to note that we do not require SSH membership to obtain the certifications. While obviously there are benefits to SSH membership, just as there are benefits to enrolling, being a member in your Canadian societies, we don't require that because that's an additional barrier. And in fact, even in the US, there's actually some things that would be illegal about that to actually require that as part of it. And it would be very limiting to the rest of the healthcare simulation community. So we decided, nope, we're not going to require this. And all we need to do is just have that profile because of how our electronic systems are mapped together with the actual candidate management system. So once you have that profile in there, you would, of course, then click over to the candidate management system, and that's where you complete the application. You can see some of the main pieces of it there, such as the educational work history. There's a few narrative statements that we ask for just to get some idea of your actual activities in healthcare simulation. We do ask for references. It's not letters that you have them write ahead of time. This is a confidential process that the individuals get an email where they fill out some basic information through a combination of Likert ratings as well as some observational statements that will help our reviewers when they're looking at your application to, again, gain that understanding, make sure that you meet the eligibility requirements and intent of the certifications, so that when they're looking at it and improving your application, all that goes through that way. I do want to mention that there may be some of you on the call for whom English is a second language. The accommodation request for that, which is typically extended time, as well as any other accommodations, are in the application process as well. It's a simple checkbox, and that starts the process up. Because many of you probably are very good at French, but perhaps not so good at English. We're not trying to test you on your English abilities. We really want to focus on, of course, your knowledge about simulation and educational methodologies and so forth. So while it's imperfect, at least the extended time helps minimize that barrier. Last part of the application process is submitting the payment. That's the only time you have to make a payment when you're going through and doing the examination. Unless you were to have to do a retest where there's a much reduced fee for any retesting. One of the big questions we get is how to prepare for the exam. And I would start by encouraging you to think about what your particular study style is. Perhaps many of you prefer to review articles and books individually. Others may be more effective in their studying by working in small groups. We've seen a lot of, so if you want to call them like journal clubs, where small groups get together and they assign articles and the group comes back together just to present on those articles. And that helps everybody come up to speed on what those concepts are for the particular components in the examination blueprint. So again, just think about what works for you and then go from there, be it some people just, again, have preferences, and just, of course, work with what works best for you. I did mention the examination blueprints. These are published on our websites. I suggest that everybody start with just printing those off and turning them each into questions. And it's obviously free to do that. You don't, you just go through and have a little process. And if you're able to answer particular items robustly without having to think about it, then you probably don't need to spend a lot of time studying it. And you can focus on those items which perhaps you struggle a little bit more in answering with the depth and breadth that you might feel comfortable with. We do have things like practice exams, review courses. There's other course plenty resources out there, articles, journals, and so forth. That we're seeing a lot more programs that are out there that are not SSH supported, but they're very good review courses. And so we just encourage you to think, no matter which resources you are looking at for helping you to evaluate your knowledge and then to study for the exam, just make sure you choose them carefully, because unfortunately they can get quite expensive if you're not careful. And we certainly don't want you to spend a lot of money and then feel like you didn't get a lot of something out of it. So just look at those resources and evaluate them appropriately, again, based on your own study style. And that should, of course, support your getting a more successful result on the exam. A couple of key points to make sure when you're approaching the examination. The questions oftentimes have some context around them, which may feel confusing. So sometimes you'll be setting up a simulation for those in the ER. Other times it might be for an ICU. Oh, this time it might be for nursing learners or paramedic students or those sorts of things like that. A lot of those things are purely contextual. We are not testing on, do you actually know how to set up simulations for paramedics? Many of you on the call may be nurses and don't know a lot about actual paramedic practice, or vice versa. We're not looking at the actual practice. We're looking at the underlying simulation components that are important, the educational components that are important. So just make sure you look through that surface context to then get to what we're actually asking, because that will help you understand what is intended for the question. And don't think that it's like, oh gosh, I don't do anything for paramedics, how can I possibly answer the question? It's just a context piece. So just a reminder about that, just to make it, again, easy for reading, and look at what's actually being asked when you look at those questions. And of course, you're going to have to read all those answers given what you identify as the key thing that's being asked. The other thing that's next on the list is to remember that these are written for that 2-year competency lens. And that's that 2 years eligibility criteria that we discussed a couple slides ago. And it's very, very easy for individuals to get beyond that, especially for, again, many of you on the call may have 8, 10, 15, whatever years in healthcare simulation, and you start to think about, there's 2 dangerous frameworks. One, you're much more an expert, and the other piece is that you may start looking at questions in the framework of your own simulation program. This is a 2-year competency exam that is for healthcare simulation as it is practiced worldwide. So remember that when you're answering the questions. I know the example I often give to people is that I've been a paramedic I'm on my 27th year doing that, and you would think that the advanced cardiac life support exam would be the easiest thing in the world for me. And it's actually one of the most difficult tests I take every 2 years, because of the fact that I start overlaying real patients that I've taken care of in those 27 years, and I stop answering the actual question. And I go back to my individual practice for that individual patient that I took care of. And of course, it makes it very difficult to answer the question, because that's not what the question's asking. The question is much more at the beginner, basic, what does the book say about what to do for the patient as presented? And so just remember that 2-year competency lens for the general healthcare simulation practice as listed through the examination blueprint. And the last thing on this list is just to remember that they're not usually simple recall questions, because we could certainly do a number of definitions and what is this, and what is this, but it's a very boring examination, and that doesn't necessarily distinguish those who actually have that 2-year level of competency. And so a lot of the questions are, you have to think through what the answers really is given the situation in the question. And this can often be quite difficult, and that's where you have to be able to pull that apart and understand the differences between the questions and the answers, because it's, if you haven't written questions before, it's difficult to come up with a question, a little bit more difficult to come up with the correct answer, but most difficult to come up with alternative answers that are plausible but somehow a little bit off. And you can't obviously make it so obvious that the question is super easy. So just remember that we're looking for what is the best answer given the question. And again, goes back to just reading through all those things. And again, how many of you have actually told your students, make sure you read the question and all the answers, and then we turn around and come to take the questions ourselves and completely forget all the things we tell our own students. So just remember those things as well. Just a reminder that we have to map everything back to the examination blueprints. We can't suddenly decide somewhere along the line that something was missing and added in. Again, we do have those posted for your download whenever you get a chance to do it, both the high-level blueprint and the detailed blueprints. And you can see this is the high-level blueprints for each of the certifications, and it lists the main domains as well as the percentage of each on the examinations. A little different than our first go around where both CHSE and CHSOS had 5 domains. The new one now has 4 domains for the CHSE, and of course you probably see some of the different terminology if you've seen our previous examination blueprint. But a lot of it was just reorganization and clarification of language. So again, there's no major new content of note to either one of the examinations compared to the previous examination blueprints. But we reduced some of the duplication and again, clarified language to make it easier for individuals to understand what exactly we're looking at when you go through and do the review. And as you can imagine, one of those components was to use more deliberate Bloom's taxonomy in our language. And so if you see something that says identify, we don't expect a high level performance as those items that perhaps start with a verb like apply or analyze, those kinds of things. So that should help you understand the depth of knowledge that's needed for each of the listings in the domains when you're going through the examination blueprint. Just a quick overview on the test when you're actually going through it. It is 115 questions long for either one, CHSE or the CHSOS. Normally it's a 2-hour time limit. You can see that we extend that to 3 hours for those for whom English is a second language. They're all multiple choice questions. So 1 question, 4 responses. We don't do the some, none, or all. That doesn't count as one of those items. We do have some pictures now that we've been able to employ on some of the questions, so we get a little bit of variety like that as well. That's more for the operations specialist examination, but we're starting to get a few of those diagrams or appropriate, again, pictures, things like that for the CHSE exam as well. But that's to make sure everyone understands what to expect when they get into the examination, the length, and so forth. And of course, once you're certified, we hope you continue to keep it. There's 2 different ways to keep your certification. One is to retake the examination. Funnily enough, we don't find a lot of people that are super excited to take the examination again. And we actually recommend that you renew through continued professional development. And one of the reasons, of course, is we like to see your expanding practice over time, be it either in simulation methodologies, educational methodologies, or for the operations specialist role, those OS-related type of activities. And there's loads of ways to do this. You don't have to attend conferences. Yeah, perhaps you do committee work that helps get your simulation program involved with the hospital. Perhaps you have a community of practice. Of course, there's online videos that you can do, all kinds of things that actually are about continuing your professional development, not just doing your job. That doesn't count because that's not, that development piece of it. But again, lots and lots of things that are all on our webpage if you are wanting to see what that looks like. It's kind of a novel process, and different things are weighted differently as well. So for example, if you just attend a session of the conference, the weighting on that is 1. for that 1 hour of time if it's a standard 1 hour long type presentation. If you were to present it, however, it's actually worth twice that, because we recognize that obviously it took a lot to put those presentations together, and therefore it's worth more than just that 1 hour time. And so it's actually worth 2 hours, the 2 continuing professional development units. And the total you need over the period of 3 years is 45 CPD. And you can, again, see on our website what that entails. It's, again, a very nice process that allows for a lot of activities. A quick overview on the CHSE-A, that's our advanced certification on the the educator side. You have to be a current CHSE prior to applying. It's a portfolio submission. We are looking primarily at that higher level of educational expertise and, of course, leadership characteristics related to that as well. Also has a higher level of requirement that you'd actually need the master's degree or an equivalency for that master's degree. Again, more on the website if you wanted to look at what that would look like. Part of the reason we put this together was that it actually gives a nice map for your professional development, that you can obtain the CHSE first and then move on to the CHSE-A and maintain that moving forward as you evolve into a higher level of expertise and leadership in healthcare simulation. That's the primary presentation that I have put together for this today, and so the rest of it now is actually just to take your questions and make sure that you are confident with everything that is here, and if you're ready, then to move forward into the process of becoming certified.
Great. Thank you so much, Andrew. That was fantastic. Very comprehensive overview of the examination process. So we open it up for questions. We have a few questions that I can start off. What resources would you recommend as a preparatory guide? You had said that there are resources, online courses, there's books. I know you personally, but from your experience with students who have taken or individuals who have taken this exam, what do they actually talk about being helpful?
I think, again, it goes back to that first question of what works for you as an individual. And I mentioned, things like the journal clubs or individual studying. I know for myself, when I've gone through college, I never particularly enjoyed doing group work because there always seemed to be an uneven application of work ethic, and oftentimes the conversations weren't necessarily so useful as I might have found. And so I for myself, for example, typically prefer to do a self-guided studying. And that's where, again, one of my first recommendations to people is to start with that examination blueprint, and then just go through and turn them into a question. So what do you know about debriefing concepts or needs assessment and so forth? And if they're easy to answer and you feel like you have a pretty good understanding of the key concepts behind them and so forth, then you don't have to focus on those. But if there are other elements that are more challenging, it not only gives you a great chance to look into it and improve your own knowledge, but also, of course, then focus on the areas that you don't feel quite so strong about. So if you wanted to learn more about feedback or how to develop objectives or some of those things like that, that's all going to help you as well. Now, there's, again, a lot of resources out there. Some of them, which unfortunately I've heard are a little bit misleading for people, and that's where that examination blueprint also becomes critical. So if you were to go to a different review course or perhaps get a book or something like that, there can be oftentimes a lot of information that's excess. You just don't need to know it. And so I'll use one example. I've heard people say, oh, I thought we had to know about Kirkpatrick's theories of education or scaffolding or all these sorts of things like that. And we don't actually ask about any particular theory for educational design or learning theories or any of these types of things. We do ask about common concepts. So if I had to say, well, if you looked at those various theories out there, what are some of the common concepts that you're going to find no matter which one it is? And for example, I think everyone here on the call would agree, well, each learner has unique needs, and so you need to identify what those are. Perhaps about their learning style, perhaps it's about identifying where they are in the learning process, because again, I don't know who I have on the phone on the call here today. Perhaps you teach nurses, or perhaps you teach paramedics or physicians. I don't know, but I know for paramedic students, very rarely do they come in without any kind of experience. Almost all of them have been an EMT for a couple of years. Some have been actually EMTs for a lot longer, and occasionally get the brand new one through that hasn't done anything. But each of those would be a very unique learning need. And so if you look at the various learning theories, obviously, they would have recommendations about how to approach each one of those. Perhaps they need less support to start off with, or more support, and so forth. And so that's, again, when you look at those, your learning, your studying, your own personal studying style, and when you're looking at all the resources that are out there, just make sure they tie back to the examination blueprint, and that you're not getting a lot of that extraneous information and spending a lot of time studying something such as, oh, I've got to go memorize all the levels of Kirkpatrick's theory. And the answer there is, of course, no, you don't. So I would definitely recommend that whenever you're looking at anything, be it an online course, an in-person course, books, all those types of things like that. And even all the wonderful textbooks that are out there. There's great textbooks, by the way. Adam Levine has done a great one. Beth Mancini, Beth Ulrich have done some great ones. Again, I can go on and on through the list. I mean, we have even the one that SSH has published that is more focused towards simulation programs. That is the Designing Excellence book. There's a lot of great information in there, but a lot of it has nothing to do with the examination blueprint. So you want to kick out all that extra and not spend time on that for right now. You can leave it for another time when you have some downtime to perhaps investigate those other topics.
Is there perchance like a list of resources that potential writers can use or can access?
Yeah, we do have a couple of lists of citations that are on our website right now. I will tell you right now, they're a little bit outdated because we've been trying to de-emphasize a static list of resources. The ones that you see there were some of our original ones we used when we were starting off with our item writing and putting questions together. A lot of them are still quite valid, of course, but we really prefer that you focus on process, so accessing journals, perhaps your colleagues, and through conversation, even going, there's various boards, discussion boards and things like that, to ask the questions and focus on the concepts that would be important for, again, if you're trying to answer the question, what are the key concepts of debriefing? There's lots of different ways to go about doing that. And depending on one static article where we may have used a couple of lines out of it to support the writing of a question, then that can be a lot of extra reading and you don't get a lot of return from it. Does that make sense?
Yeah.
I hope. Yeah. And so that's just, we want to encourage you to focus on what's actually needed, rather than, again, if you go and look at those lists, by the way, I think the short list has 35, 36 articles, and there's another one that has an additional 50 articles. You can imagine how much reading that would be, and a tremendous amount of reading. Some of them, of course, are textbooks, and it could be just one section of one chapter that the question was relayed to. Because the questions, when they're written, must tie back to both the literature and they must tie back to practice. So it actually has a double grounding. It can't just be something theoretical that's not applied. It actually has to have some application in our work setting as well. That's why a lot of reaching out to your colleagues can be so valuable, just either in your own simulation center or, of course, other ones, to make sure that you're not just following a practice that's particular to your simulation center.
Great. All right, that's wonderful. We have another question. You talked about the recertificate, it's good for 3 years, and you talked about having that professional portfolio. If you could go back a couple of slides, you talked about the credits for presenting. We don't have any of that in Canada. So how do you account for that, or how do you base it on?
You still typically get a an attendance certificate. I know I've been to a couple of conferences in Europe and even up there in Canada. I've been to the Sim1 conference just a couple years ago, and you normally at least get something that says you attended. Even in absence of that, you could look at your clock hours that you attended the conference. So if you went from 8 to 5 each day with a lunch break, you could credit 8 hours for that day, for example. And you'd have to break it up by the domains. Again, if you look at the renewal information, you obviously have to have a piece in each domain. But if you don't have a certificate, at a minimum, we just have an honor system for the renewal. You don't submit the documentation ahead of time. But if it's just a randomized process that if you submit, let's say you even attend this session today, that you just have to have someone be able to verify that you attended. And you would just have them send an email in or a letter, whatever is easiest and or appropriate for the particular activity. And then that just verifies that, yes, what you submitted as part of your CPD actually occurred and you participated in it.
Okay, great. And there's another question about the CHSE.
Uh-huh.
And so what are the criteria for that? And can you bypass the CHSE and do obtain certification as a CHSE?
You cannot bypass the CHSE first. The certification group, when they were putting this together, discussed that, and we decided basically if you have to be able to demonstrate the 2-year competency before you can move on to that higher level set of skills. Not always agreed upon, I would say, but that's the model we've had, and at this point that does not appear to be up for change or anything like that. And so you do have to have CHSE have achieved that first, and it has to be current. Then you can apply for the CHSE-A. Now the eligibility criteria for CHSE-A are almost identical to CHSE. The only difference is you need 5 years of experience and that master's degree. So you can see again that it's got that extra layer of expertise. And of course, by 5 years, you should be demonstrating some components of leadership as you're advancing in your career.
Okay, and I think there was a question about what are the pass rates for international, or what are the pass rates for anyone for the CHSE, and what are for international?
Right. It's historically for the entire history of CHSE, I believe the pass rate is running 71, 72%. I need to add in the last years. The international pass rate is lower. Unfortunately, that's tied to those for whom English is not their primary language. And so that's where we're seeing that primary difference, which is a bit frustrating. And that's where one of the reasons we're actually going to look at starting to do some translation moving forward. We've got to work with our board to get the funding for that. And we'll also be working with our affiliates around the world to make sure that those translations are as accurate as possible and still contain the key concepts of the intent of the question, and of course, how it's written and how the answers are written as well. But generally speaking, we're pretty pleased with that pass rate because we're fairly confident that the questions are written well, and that while not everyone passes who would like to, when on review, it's very interesting to see what you get back in terms of feedback. And a lot of people, it's like, I wasn't ready for the tests, or I realized I'm not quite to the 2-year competency level and some of those things like that. No process is perfect. We recognize that as well. And so that's why we continue to look at things from a psychometric perspective, make sure we have the right questions on the exam and so forth. It's actually quite an interesting process if you like statistics and stuff.
No.
So, and I see a question here about the cost. It's for the SSH member rate is $395. If you're not an SSH member, and that's US dollars. If you're not an SSH member or a member of one of our supporting organizations, again, you can see the list on our website. then that would be $495, and the retest fee is either $175 or $275. Again, the same breakdown for SSH member rate and supporting organization rate versus those who are not. I know we're going to be reaching out to all of our affiliates, such as Sim1 and so forth, to see if they want to move forward into that support role. Because the idea, again, is it's if it's perceived as a value to the healthcare simulation community, there are mechanisms to obviously work to have those support statements that, again, certification has meaning, and to go from there.
Okay. And this is just a personal question. How do you say it? Because I've heard cheesy, cheze, shaza. So how do you?
Officially, the official way is CHSE, because any of the other things are just obviously means of ease of communication. I know for myself, when I shorten it, I usually just say it's the E certification or the OS, or those sorts of things like that. I think I've heard like 8 different different ways to pronounce it for shortening, and the important thing is if people are at least aware of it and talking about it, that's obviously what we'd hope for, is again for people to see that, hey, there's a certification out there that I can achieve, and is it valuable to me, and then move forward if they say yes, it is.
Great. So I don't see any other questions that have popped up. Just seeing if Marion has anything further to ask herself. Looks to be okay. Well, I'd like to thank you very much for your time talking to us. We'll have this available on the CanSim website for anyone who wants to kind of review this, but we really appreciate you taking your time and attention on this. It's very important that we have certification programs that define the excellence in simulation.
Yeah, and if I've got my email address up here, if anyone has other questions, or of course you can just email Jane or Marion directly, and they can forward it to me to get the answer for everyone.
Thank you very much. All right.
Thanks, Andrew.
You bet.
Bye-bye.
Bye-bye.